Welcome to episode 6 of the Movement Prescription podcast. And my name is Hussein. You're lucky today because I'm not going to be chairing this podcast. Instead, my incredible colleague Suzy is going to be speaking with Dr Emma Lunan about how we can realistically encourage our patients with chronic health conditions to move more. Emma's a GP with a specialist interest in sports and exercise medicine and recently chair of the Movement for Health charity in Scotland, set up as an answer to the work of the Richmond Group of charities in England. You may have heard of the We're Undefeatable campaign. We had them featured on episode 2 of this podcast. During today's episode, they touch on the importance of having the confidence to start these conversations, as barriers are not always with the patients, but often in us too. They talk about the power of peer support, and they introduce some key resources and helpful charities where you can find out more. So, without further ado, I introduce episode 6.
Welcome to this week's Movement Prescription podcast. The aim is to provide CPD for primary care staff around physical activity, to inspire them to take up more physical activity and promote this to their patients, and to educate the listeners to the latest knowledge, current guidelines, national and local opportunities, and further resources and education. My name is Dr. Suzy Scarlett, and I'm a GP and GP trainer in North West Edinburgh, working in an area of deprivation. I'm NHS Lothian Primary Care Lead, having previously worked with the East Region Diabetes Prevention and Remission Programme. I have a BSLM diploma and now integrate my learning techniques and evidence into my everyday practice where possible, and hope to inspire you to do the same. All views here are my own interpretation of the guidelines and resources mentioned and the show notes. It's an absolute delight this week to be here with Dr Emma Lunan, a GP, sports and exercise consultant and clinical lecturer at Glasgow University for Sports and Exercise Medicine. She's recently chaired the Movement for Health, a Scottish coalition of Scotland's leading health charities, working together to make it easier for people with long-term health conditions to be more active for social, physical, and mental health benefits outlined in episode 1. Emma, it's wonderful to be here. Did you want to introduce yourself?
Thank you so much for having me, Suzy. That was a lovely introduction. Yes, as you said, I have a number of hats. Primarily, though, I am also a general practitioner working in the west of Scotland. So most of my patients are living with long-term conditions, which is why this is particularly relevant to me and my work.
So today's show, we're going to talk about trying to get our patients moving a little bit more. And as you say, it's the patients on the ground. And whilst, I'm aware that you are a keen sportswoman and involved in quite a lot of elite sports, as well as your involvement with chronic health, that your feet are firmly on the ground when it comes to the reality that most GPs face every day.
Yeah, I would definitely say, having spent most of my working life in the west of Scotland, Glasgow, and now my practice in Kilmarnock, that the majority of my patients are not elite athletes by any means. And absolutely many have long-term conditions and face many barriers to becoming physically active because of that. So yes, I would like to think my feet are firmly on the ground.
So a few rapid fire questions for you to get us started, Emma. So in which chronic disease or diseases do you think the evidence is strongest for physical activity interventions?
I think that there are, as we know, a multitude of diseases. In fact, the majority of diseases, non-communicable, are all benefited by increasing our physical activity. I guess the majority of evidence is in cardiovascular disease, because that's where a lot of the research is. However, in saying that, the research is increasing exponentially in all diseases, so diabetes, respiratory disease, neurological disease. So that's maybe a failure to answer that question and a winner, but I'd say cardiovascular.
And I guess what lots of GPs will be worried about is the safety of recommending our patients with, for example, cardiovascular disease to move more. As a quick reassurance to people, what would your sort of top tip be?
So I think that people tend to overthink it and think we're going to make them go out and run a marathon or do a 10K, but literally just any kind of movement is going to be beneficial. 1 minute, 5 minutes, 10 minutes, any movement that fits that person. So that could be moving at home, chair-based moving, a variety of things. So don't be scared. And there's lots and lots of resources out there that are amazing that can help clinicians introduce the concept of physical activity to patients with conditions such as cardiovascular disease and diabetes and COPD. I know we'll touch on this later, but in general, movement is a good thing. We want to be physically active, and it's the majority of physical activity that's going to harm a patient is absolutely minimal. So don't be scared.
Brilliant. Start low, go slow.
Yeah.
That's always my line to patients. I had one who promised me he was going to do that and then injured himself at parkrun the next week. So we do have some cautionary tales to share as well, but absolutely every movement counts, as the WHO is saying. I love this phrase. If physical activity was a drug, we would refer to it as a miracle cure for the great many diseases it can prevent and cure. But do you see physical activity prescriptions becoming a routine part of clinical practice in the next 10 years?
So I guess it depends on the definition of prescription, in terms of it might not be that we are going to be didactically prescribing, you must do this, 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 and lots of patients will not respond to that. I would maybe say physical activity conversations will be increasing and incorporated into our daily practice. Some patients will respond to a prescription per se or a referral to exercise prescription. Some might just need that initial conversation to spark an interest. So I would like it to be, but it might be more of a spectrum of discussion with patients.
And I suppose that brings me on to my last rapid question, which is, are you in a Royal College of GPs active practice? Are you on their charter?
Yes, we are. We are indeed. And I would say that was one of the first things that really got me interested in increasing physical activity with my patients and with our staff. And I think initially it was a bit daunting. You can look at it and think, this looks like quite a lot of work, but actually it's really easy to become an active practice. The RCGP website has got so many good top tips. There's so many resources out there, and lots more practices are coming on board. It really gives the practice a boost. The staff get on board, admin, clinical staff, non-clinical staff, the GPs, and obviously the patients as well. So I would wholly recommend that if anyone is not involved with being an active practice, they go and have a look at that.
And Emma, I just would like to give you some positive feedback. I don't know if you remember when we first started chatting many, many months ago, you told me about a World Walking app that you did in your practice with your staff.
Oh yeah, they loved it.
We are now just starting. Yeah, we love it. We're now on our 14th walk as a practice. So thank you for introducing me to that. We're about to walk Vietnam. That's the current route.
Oh, amazing. And it's such a simple thing to do and get involved with.
Such a simple thing.
Yeah.
Like you said earlier on, I think we overcomplicate so many of these things, and keeping it simple and straightforward and engaging people, I think, is really the beauty behind all of these things. So
absolutely
great. Right. Well, I wanted to talk a little bit about the science then behind physical activity and in chronic health. So can you explain to me, as frontline GP, I don't have a qualification in sports science, but why is it that physical activity is so good for our health in a nutshell?
In a nutshell, because it has so many positive benefits on so many different systems. So I mentioned cardiovascular disease. Well, the positive benefits to our cardiovascular system, endocrine, immunological, our central nervous system, our musculoskeletal system. So all these systems are affected when we exercise. And when we exercise regularly, it produces lots of anti-inflammatory mediators and reduces the pro-inflammatory cytokines that are causing all these, inflammatory-based diseases such as diabetes and obesity. We increase our skeletal muscle mass, which improves our glucose uptake, and we also reduce our body fat, which obviously, again, is pro-inflammatory, as well as all the lovely hormonal changes that happen with exercise. And that can be ranging from a reduction in cortisol to stabilizing our sex hormones. So if you imagine all these different chemicals being released, hormones being stabilized, and improvements in our MSK system, overall just have lots and lots of positive benefits.
And that can come from simple movements, or does it have to be that you go out for a 20-minute run, or you're doing your strength training however many times a week it is that you manage?
So, I mean, obviously the WHO guidance, you might have discussed before, is that we try and undertake 30 minutes, at least 30 to an hour of moderate activity, and that's 5 times a week, as well as strength and balance. But even really tiny amounts of exercise are beneficial. So I don't want people to think I must be doing that, or I'm going to fail, or there's no point in me doing anything because I need to be doing this 5 times a week. As you said, Suzy, start low, go slow. Anything counts. And even, things like high blood pressure, hypertension, it's been shown that as little as 3 minutes, 3 to 10 minutes can have a longer lasting effect on blood pressure. So I would, happily say to patients, just do something for 3 minutes. And that we know from studies that that's going to have a positive effect on your blood pressure. It's so easy.
It's brilliant when you can break it down to that sort of simple statistic, isn't it? So that is something achievable, I think, for patients to aim for, and something that is relevant in their day as well. A lot of my patients, we spoke about the World Health Organization physical activity and sedentary behavior guidelines. I think they're brilliant, and I absolutely love the infographic. I spoke about it in my last podcast as well, with the trajectory that you get with however many minutes you do of physical activity within the week. And so often we're dealing with a guy sitting in the chair, and the trajectory there, if they just do a little bit more, they are the ones who are going to gain the most, aren't they?
Absolutely.
So it's having a chat with someone who is maybe a gamer, or, maybe in the older generation with their cardiovascular disease or COPD, if they love to sit and watch telly. It's about having that trigger. It's the commercial break, stand up, walk around the room, do a couple of chair squats, whatever it might be, lift your legs up. Is that the sort of...
Yeah, go and make an extra cup of tea, go and just something really simple, but just keep moving. And I get you kind of touched on, obviously, sedentary behaviour, which is a huge problem in equal measure. So it's not just increasing physical activity, but reducing the time that we're just sitting. And that can be obviously the older generation, as you said, but now, as we're all working people, and as GPs, we're just sitting all the time. So a simple thing that I do is just get up and walk to get my patients, which 2 years ago I'd stopped doing because I was so busy.
And I feel like a broken record because I'm always harping on about my standing desk, which is one of the first things the patient will see when they come into my room, is that my desk is permanently up. And I'll sit and I will focus on them and talk to them. And then I'll say, do you mind if I just stand up to use the computer? And they say, well, why are you doing that? And it starts a conversation, doesn't it?
It's such a good, opener to a conversation. And they either think you're crazy or think this is great. Why not? It's brilliant. So yeah, we have like our standing desks as well. We have them.
And I think, particularly in other chronic conditions, you've mentioned ones like cardiovascular disease, and we've touched on others, but, chronic pain, which I think is one of the most difficult ones to tackle because, you're in pain, you don't want to move. How do you break out of that cycle?
So I think it is very difficult, and particularly after we've come out of the COVID pandemic and we've got thousands, if not, millions, well, thousands of patients waiting on joint replacements. We know that burden has gone up, and particularly when they're in pain, as you said, they don't want to move. So I guess it's a bit about education that they're not going to do themselves any more harm by being active, that these tiny movements count. So it might just be looking at joint flexibility, that hopefully we know that exercise as we touched on, reduces the pro-inflammatory cytokines and inflammatory mediators. Obviously, I wouldn't say that to a patient, but the exercise will help in our pain control. And then, looking at different types of exercise. So hydrotherapy is great for patients with joint issues and arthritis, if that's available in your area, or even just going to the swimming pool and taking the weight off your joints. So yeah, pain is a very difficult thing, but there's again amazing resources out there for talking to patients. So moving medicine, for example, versus arthritis has got some wonderful resources looking at pain.
I really like the resources on the Flippin' Pain website as well, as my Live Well With Pain. I use them with a chronic pain group, actually, and just understanding the pain cycle. And as you say, understanding the theory behind pain and that pain doesn't always equal damage.
Yeah.
And I remember dropping that phrase in a pain group, and the room went silent and they all started looking at each other. And there's this beginning of this shared understanding that, oh, hang on, that's been a belief for years and it stopped me doing so much. Maybe there is a different possibility. Maybe there is a different way of doing things. So
in one of my hats, I'm dealing with a lot of more able patients that maybe have injuries or long-term issues, but certainly they are in pain all the time, but I would always say, well, yeah, you can keep moving within the realms of your pain. You don't want to push it beyond a certain level, or if it's getting worse, but you're not doing any more damage. In fact, we need to stop that perception of things. So yeah.
So that's fantastic. So we've touched on anti-inflammatory pathways, musculoskeletal health, and you were referring there to, I think, the glucose sink in what I would think of very simply as the glucose sink in diabetes. How can we help patients understand that, the more active you are, the better your body utilizes the glucose?
I guess, as I said, we could talk about how as we get more active, we are reducing our fat in our bodies and increasing our muscle mass. And our muscle mass provides this amazing reservoir for glucose. And obviously the problem with diabetes is that we've got far too much sugar. I talk to patients about that. And then it's mopped up by the muscles, and the exercise increases this. So I guess to keep it in really simple terms, and try and get them to understand that it's just a way of regulating their diabetes by exercising more, and they're not going to do any harm.
And I suppose if this is a patient with type 1 diabetes, then the fear from a clinician, if they don't necessarily understand the science behind it, is, well, gosh, what if I cause hypos? What would you say to that clinician?
I mean, the thing is that hopefully, well, there's different options, firstly. So I would always advise, if it was a type 1 diabetic patient, probably to make sure that they've got enough nutrition on board, that they've maybe got a supply of carbohydrates, short acting there, that they're aware that they're hydrated, that they know how much exercise that they're going to do. So they're not going to be caught short. A lot of time now, the patients have freestyle Libras as well, which is great. I've just done that myself as part of the Zoe study, which was very interesting. So they can look at their blood sugar immediately, which is fantastic. And I would advocate that on anyone.
The technology that I think is going, is really helping and removing some of these barriers that we see. And hopefully we'll talk a bit more about barriers shortly. But I think we can't ignore either the not only the disease-specific benefits that you've already mentioned, but the social benefits and the societal benefits. And it's, we're hoping, and we need the government to prioritise this. And I suppose with your hat on from chairing the Movement for Health group, maybe you've got some insight into whether this is coming from the top down, because obviously we're grassroots, bottom-up approach. But what about the top-down approach?
Yeah, I guess from my time in Movement for Health, I've realised that we can all do our bit, and we all should do our bit. But it's absolutely of utmost importance that the government, I guess, pays more heed to the ongoing issues with physical inactivity, and that policies are introduced that change things, and it's got to come from the top down. And I must say, it is quite hard to influence. But what I have realised is there are lots and lots and lots of people, practitioners, academics, government official, politicians, and we do want the same thing. It's just to try and keep influencing the top level to spend their money in the right way and create the right policies. So I do think things are changing. There's certainly enough people that want to make a change, that want to make a difference. But as I said, it's got to come from the top down. There's been a recent policy document by the DCMS just released on the 30th of August, and that's the Get Active document. And it's looking at the strategy for the future of sport and physical activity. And it says they're building a healthier nation by tackling high levels of inactivity, making sure that sport and the physical activity sector is thriving for future generations. So I would urge people to go and have a look at this document. The governments across the nations are definitely thinking about things and getting involved and putting policies in place, but we definitely need to do more.
Oh, I'm fully aware that there's all sorts of public health priorities in Scotland that comes under my diabetes work and things. And, it is there, the willingness is there from the top down. But I guess us as GPs, we're often the last ones to see that until we go out looking and seeing what's available in our communities. And I see a large part of our role,
absolutely,
not necessarily in offering these physical activity programs, which I know there's lots and lots of initiatives like Walk with a Doc, Run, Talk, Run. What else have we got? Hussein, who does a lot of these podcasts, he is running a fantastic lifestyle group.
Oh, yeah, he's
prolific.
Amazing.
For people like you and I who are juggling many plates and trying not to drop any, then often it's about reaching out and seeing what's in our communities, what's available already. Is our local leisure group. So here in Edinburgh, we've got Edinburgh Leisure. They have got an active communities, a whole menu of options for people, from weight loss to getting back to movement if you haven't done it for a while, to chronic disease groups, to chronic pain groups. We've got local football groups. They're doing walking football, mental health football. There's all sorts of things out there.
It is amazing. And I think actually, if you delve into any community, any health board, any area, there's just a plethora of activities, as Callum Leese knows from all his work. So yes, it is amazing. It's just trying to signpost to the right places, isn't it?
And yes, and that's where the knowledge comes into it. And so that brings me nicely on to asking you for a little bit more information about this Movement for Health charity that you worked with before. Tell us about your time with them.
So I was really lucky to get involved with Movement for Health just at its inception. And Movement for Health is a coalition of 19 charities within Scotland, and also several partners, including the University of Edinburgh and Public Health Scotland, that really came about as a group to help improve and inspire people with long-term conditions to be more physically active. And over the past 3 years, I would say, we've really started from nothing and built up some brilliant resources. We have a really good website with lots of resources and local activities that you can look at, that we've linked in with all these charities. And we've been able to join several important groups in Scotland that really help influence the increasing physical activity in people with long-term conditions. So it has been really exciting. What I've realised, it can take quite a wee while just to get things moving. And as a GP, we're used to firing things, getting done quickly. But when it comes to influencing government and policy, it can take a wee while. So At the moment, we're just having Movement for Health just undergoing a review to see what direction best to focus on. But it's really exciting, and hopefully we'll be able to have some positive outcomes in the future.
And they've been looking at things like active health and social care, active travel, active places and spaces. So it's really sort of thinking about that whole system, not just getting individuals to move more. It's more looking at the bigger picture, isn't it? Definitely.
Yeah.
And there's such a broad spectrum of charities that are involved, isn't it? Everything from Dementia UK and, am I right in thinking, Macmillan and Asthma UK and all of these ones?
Yeah, there's so many charities that we've got on board, and they're all amazing. And it was great in the latter stages of COVID. We have 3 monthly meetings. And all the charities would come and tell us what they'd been doing, and for the people they work for with long-term conditions. And there was so many positive things going on that I just didn't know about. So the whole experience has been amazing.
And, it's one of the things that I saw on the Movement for Health website was that the evidence demonstrates that those with long-term health conditions are twice as likely to face the greatest barriers to participation. So what can we as GPs do about these barriers to participation?
Yeah, I guess we need to identify what the barriers are.
So what about patients with disability?
Yeah, so Disability Scotland are some of the members, or one of the members in the coalition, and they actually have a new policy in place to increase physical activity in those with disabilities. So it's starting with top level, improving access to facilities, changing the leisure facilities that are available. Making sure that people have the resources, because things cost money. I went to Scotstoun Leisure Centre, for example, to look at their disability tennis, and to participate, and to hire the hall, it costs an absolute fortune. So it's giving resources to trusts and sectors to be able to allow to give these opportunities to people for less, because money's a huge thing. So resources, there's so many barriers, unfortunately, but there are things we can do, which is the positive thing.
And again, as GPs, we're very aware of the stigma, I think, that a lot of people experience when it comes to thinking about getting involved in movement, physical activity, possibly exercise, but I don't like to use that word with my patients, because I think a lot of them will just switch off as soon as I mention the E word.
Yeah.
And I try very hard to sort of soften my language, but what can we as GPs, how can we overcome the barriers? Stigma, I think, is a massive thing, isn't it? Particularly with weight, with culture, and ethnicity. If this isn't something that people in your culture do, how can we help that?
Yeah. I think we need to be comfortable talking about it for a start. So the way that I've gone about things is just to try and bring up activity in every consultation if possible. It's not always possible, it's not always appropriate, but in the majority of consultations I just treat it as I would previously in terms of smoking or alcohol, and try and incorporate that way, and having a conversation, a dialogue. And if the patients seem open to it, then I would then talk a wee bit more about opportunities. I think that there are many, many barriers to physical activity. And yes, it's about eliciting what that individual patient's barrier might be, and then trying to guide them or empower them. We need to empower patients. We don't want to be telling them what to do. They need to want to do it.
If people want to know more about motivational interviewing, Dr. Callum Leese is talking in another podcast episode with Hamish Reid about motivational interviewing and engaging patients. So hopefully you can listen to that one at a later stage too. But I think it's about engaging patients. It's about helping them see what's possible for them. It's everything that, to me, lifestyle medicine is about understanding your patient in their context, meeting them where they are and nudging them forward just a little bit. helping them to see that there's, it doesn't have to be a transaction
absolutely.
in every GP consultation. It doesn't have to be a prescription. We know they don't take half their prescriptions anyway. So, little statistical treats like what you gave us, about 3 minutes of physical activity can improve your blood pressure. And, if we can have a script or a few nuggets of information like that, I think that can really be very helpful.
Just a little, just drop it in.
Absolutely. And what you were describing there as well was a readiness assessment, wasn't it? Is this patient, where are they on the cycle of change? Is this a conversation that I've got time to talk about, or shall I just plant the seed today and leave it there, come back to it at a later stage?
Yes, absolutely.
So I have a question for you. Do you use exercise questionnaires in your daily practice?
I don't, because this is a barrier for me, but I probably feel I don't have enough time, and I don't need to. But in a different practice, not in GP, we sometimes use exercise questionnaires.
So good research tool, and in the different practice, is that more sort of athletic or individuals or?
Yeah, so that would be in a musculoskeletal set. So I do have a musculoskeletal clinic that I do. So we have 40 minutes per patient, and I can easily do an exercise assessment like that. But in general practice, I don't have a lot of time.
And does that go for prescriptions as well? I mean, have you ever written a physical activity prescription for a patient?
Yeah, I have. Yeah. So what I'm talking about in terms of like PARQ assessments, readiness assessments, I probably on a personal level go through things quickly in my head and can work it out. But I do use the FIT approach, and I would write prescriptions for patients if that's what they want me to do. And I think some patients do appreciate that and some would not. And I've often been, so you can exercise for frequency twice a week. Intensity would be moderate. Timing might only be 10 minutes. Type would be a walk. So something really simple, but they actually like that. And that's not for everyone. But yes, I do occasionally write prescriptions.
Brilliant. Using the FIT approach. Now, that's not one that I've used before, but I think maybe that's something I'll see if I can work that into a consultation over the next week or two. There's a goal for me there, Emma. I'm always inspired by you.
Good.
So that's
always learning.
Good to commit these things to paper, though, isn't it? Because otherwise, it's just an aspiration.
Sorry, you're asking about questionnaires. For me, it's just easy to. I just have my way of doing things, and then I like to keep things very simple.
But I think we have to in general practice because, we only have 10, perhaps 15 minutes to see these patients. And perhaps if you're organised in advance and it's someone coming back to see, you can get them to do something before they come. But I think within the consultation, we've got to think about how we use our time. Otherwise we're just snowed under, aren't we?
Yeah, we'd never get anywhere. And we wouldn't mention it.
No. So, just a couple of vignettes before we summarise. Can you think of any great examples that you can share with us of patients that you've spoken to, you've perhaps given some guidance on, and they've come back and their disease, whether it's diabetes or COPD, has been affected positively?
Yeah, I had a lovely patient last year who was, and she won't mind me saying this, so she was late 30s, was postpartum, and a year after her second baby, type 2 diabetic, and really struggling with her weight, was struggling with aching joints, and I think initially she'd come in because her diabetic control was quite poor. So she was getting that repeated. And amongst everything, we started talking about her being physically inactive. And she was quite isolated, just being at home with the 2 little children. So we got her linked up with the community connector. She got involved in some local physical activity groups, and we've got brilliant other resources locally with many groups that patients can go to. And I think I saw her maybe 2 or 3 times about her diabetes and her joints, and just gradually you could see the difference in her, not only in terms of her markers, her HbA1c improved, her BMI was improving, her mental well-being, she just transformed. She wasn't sore. And I think now she's still friends with lots of the people that she met in the group. She's now advocating and being more physically active, and is happy to talk to other patients about it. So it's really lovely. And that's just one patient out of many. And that just started with her coming in to talk about her diabetes and something else. So yeah, that was a nice outcome. Hopefully she'll her diabetes will keep improving, and she'll keep getting fitter and happier and healthier.
And it's great, isn't it, what you're describing there, what I would describe as the ripple effect, which is where, a patient has a positive outcome, and then they share that, and they want to actively share it, whether it be within their family circle, their friendship circle, whatever other communities that they are, but even to strangers. I had a patient the other week who's been to our local diabetes prevention group, which was a series of structured educational programs, and he really, really enjoyed them. And he specifically wrote me a note and left it in my basket to say, dear Dr. Scarlett, I would be very happy to recommend this to any other patients who want to get involved. Just having this information is so exciting. I never knew any of this before. There's so much I can do for myself. It's about giving patients that level of control back.
Yeah, and that's just so lovely, though. That just makes your
Yeah, it does. They're not all like that, are they? All these conversations that we have. But I think
But just even, if you feel you've made a difference. I know we're talking about influencing policy, and it needs to come from the top down. But us as GPs, it's good to have that individual impact as well.
And I think sharing these stories with people, that's what I think inspires and motivates me. And I think, when you find yourself and you find your tribe amongst a group of similarly minded enthusiasts, you always come away, don't you, sort of fired up to try things a bit differently, because it can sometimes be a bit lonely when you're trying to do things differently in general practice.
Absolutely. Yeah, it can. And it's hard because we are all busy and stressed, and some people are just closed off, pre-contemplative. But when you find your tribe, it's great.
Fabulous. So just as a reminder for people then, we've mentioned quite a few resources. You've mentioned Moving Medicine a couple of times. They've got fantastic evidence-based guidelines. I think that's really good for trainees, actually. I mention that a lot to trainees. How about yourself, Emma?
Yeah, absolutely. And the evidence behind it, if you delve in, is amazing. They've had a lot of clinicians work on that. So the resource is great just for that 1 minute, 5 minute or further conversations with patients. And there's a course that they offer as well. So if anyone hasn't seen it, I would definitely go and have a look at that.
The other place that's really good for information, the Royal College of GPs has got their physical activity toolkit, and buried within that are these wonderful Motivate to Move guidelines, which again are very, very evidence-based. There was a lot of work that went into that. Was it by the Welsh University of Wales, I think?
Yes.
And the Faculty of Sport.
Wales, yeah.
We've mentioned the World Health Organization's guidelines on sedentary behaviours. I just love the infographics in there. I think they're really engaging, very colourful, and I love the message that every move counts.
Yeah, I love that. I also like that one. I would say if we're talking about resources, if you have if a patient with a specific long-term condition, if you do go to the individual charity website, so for example, Versus Arthritis or Macmillan, all these charities have Parkinson's UK. They themselves have amazing reasons. I mean, patients are often tuned into that anyway, but they'll have examples of local groups and online activities and just masses of things that you can look at. So the individual charity websites are really good as well.
I've just discovered, is it Move Charity, which is encouraging more movement within with patients who are living with cancer and on chemotherapy. And they've got a fantastic initiative. It's 5K Your Way. And it's something that's in partnership with Parkrun. Are you aware of that as well, Emma?
Yeah.
So many points.
I mean, some of there's so many amazing things out there. I think we say this every time we speak to each other. It's just knowing about them, isn't it?
That's the key thing, isn't it? So listen, Emma, it's been absolutely delightful talking to you today about how we really start these conversations with patients with chronic diseases and try to help them see what's possible. I'm going to ask you if you've got one or two take-home messages for people who've tuned in. In summary, my take-home messages always are, little and often, don't overcomplicate things. Also, be careful of the boom and the bust. I think the cautionary tales I've shared, and I have more, but I won't share those now. Just caution, but slow and steady wins the race.
Yeah, I would entirely agree. As with the WHO, I would say every move counts. Don't worry that you need to be doing the vigorous exercise and be running the marathons and doing all these things. Absolutely everything counts. So if you've got a patient that chair-based exercises, going up and down the stairs, anything. So every move counts, and look at all the options that are available, and get delved into all the resources out there because it's amazing.
Yes, there are many. And, don't forget the joy of movement and green prescribing, all these things that I'm always harping on about. Emma, it's been a delight to talk to you on today's Movement Prescription podcast, brought to you by GPs on the Frontline. Lovely to talk to you, Emma. Take care.
Thank you so much for having me. I'll speak to you soon, Suzy. Thank you.
I hope you found that useful there. I really loved the conversation between the two of them, and it really did help to crystallize a number of areas which, yes, I've heard before, but it's important to reframe in order to engage patients with chronic conditions to get the most out of movement. And some take-home messages for me, including how we go about starting the conversation and how we go about framing that, as well as trying to support the patient to avoid the boom-bust cycle that we see so many, including maybe even ourselves, when it comes to implementing behaviour changes. And that whole philosophy of every move counts. You don't have to complete an Ironman in order to squeeze out the benefits of physical activity. Simple things, little things, consistency over volume. And they introduced the FITT approach when helping patients create the movement goals. I really think that it's quite a well-structured approach about doing it, and something that I'm going to try to implement more in the future. And of course, they spread the word about the Active Practice Charter. And to find out more information about that, have a look at the Royal College of GP's Physical Activity Hub, where you can apply to be on the Practice Charter if you already feel like you are achieving it, or learn on some tips and resources to make that dream a reality. And remember, it's not just there for individual practices, not at all. It's there for networks or clusters, whether you be in England or in one of the other nations of the United Kingdom. I hope you found that helpful, and thank you to Suzy and Emma there for sharing their insights and their time. Well, I hope you keep active and well, Until next time on the Movement Prescription